I'm Hrishikesh Kulkarni. I'm a pulmonary and critical care physician scientist in the Department of Medicine at the University of California, Los Angeles. I grew up in India and I was fortunate to go to med school there. So we had underprivileged people from really all over the country who came to get care at our hospital. Many of them were dying of lung injury for which there was no cure. It inspired me to get to the basis of why some people have a limited infection, but others go on to essentially die from it. And that really inspired me to move to the United States to further explore the mechanisms by which we're able to do this and use the tools that are available in institutions such as UCLA. So the focus of our lab is to understand why we are predisposed to developing lung injury and what we can do about it. Lung injury can happen due to many reasons. It can be due to pneumonia, which is the most common cause of injury. We've seen that happening with bacteria as well as with viruses such as the recent COVID-19 pandemic. We're focusing on certain proteins that are made in our lungs called complement proteins and understanding how they not only fight off infection but also help the cells in the lung to survive and thereby form a barrier that can help protect us from these different environmental stressors. The attractiveness of the system is that it's present at multiple sites in the body and it actually acts as a normal host response. The hard part is when it goes out of hand. Although there are currently FDA-approved therapeutics for the complement system, most of them work like a sledgehammer. And my hope is the kind of research we are doing is helping us identify what are the right targets, what is the location, and what is the right time at which we should intervene so we can actually benefit patients with lung disease in the setting where the system is involved. We are using a combination of transcriptomic analysis, proteomic analysis, as well as imaging techniques in order to get to the root of these questions. The University of California, Los Angeles has a long-standing history of excellence in research. The UCLA health system, as well as the hospitals, are one of the best in the country in terms of patient care. The Department of Medicine appears to be working with stakeholders in the School of Medicine and also at the university-wide level to invest in the kinds of resources that are needed to do high-quality research and continue to do high-quality research while also recruiting and retaining talented trainees and faculty to advance their mission. Additionally, they have been working with leadership at the individual divisional level and identifying barriers that can be overcome in order to make UCLA one of the best places in the country to do this kind of research and really being a place where people want to come and train as well as invest their careers to obtain fulfillment long term.